executive member meeting for adult health and wellbeing. I'm covering today for Councillor Thomas, who is unwell at the moment. So the first item, just get my agenda up. The first item on the agenda is the Department for Adult Strategic Budget Report 24-25. And who is taking that for us?
Lynn
I
Hargreaves.
think it's Lynn Hargreaves.
Lynn?
Yeah.
Hi, Lynn.
Hi. So the budget report is just setting out first of all, it gives the savings for the year in adults, which is 4 million for this year. It gives a breakdown of how the budget goes from last year's budget to the new year's budget. And then in the appendix, it has Appendix A is the budget from the start of the financial year 23-24 to the end of the year and all the changes, how it's all funded. And then you've got your budget options in Appendix B. So this report is then just asking that you note the budget, the revenue budget that is now 87 million, and approve the savings plan within the budget report. And then it's just if you've got any questions.
Okay, it's a pretty standard budget report that comes to each executive member. Is there anybody got any comments or questions? Or Lynn, if there's anything within that you'd like to, any kind of variance or anything that you'd like to highlight? If not,
yeah, I don't think there's anything unusual in it.
Okay, right. Okay, well, thank you very much for that. We'll move on to the second item, which is the Adult Social Care Fees Report for 24-25.
That's myself, Chair, if that's okay. So Tracy Mitchell here. I'm just going to talk you briefly through the paper, and I will stop and focus on a couple of key aspects. Happy to take any questions at the end. So the purpose of this paper is to set out the proposals for the approval of fees relating to adult social care, and that's for the year 24-25. In section 1, it provides an outline and context in terms of the background to our fee setting process. It also highlights the proposed fee dates, which will be from the 1st of April 2024, or as appropriate from the week starting of the 8th of April. That's due to the DWP benefits uplift. So it's either of those dates it will be aligned with. Section 1.1.3 talks to how this aligns to our commissioning strategy and how it's going to support us in the development and the ongoing work with our provider markets. And that is a theme throughout this paper. You'll note that we do continue to provide that strategic market shaping role as set out in the Care Act. So section 1 continues to talk about the fees paper in terms of its recommendations for 12 months, and it also touches on the addition of the NHS has continued to experience significant pressures this year, as we know, and that has meant that we've had to kind of work really closely as a partnership together. Whilst the council does receive welcomed one-off grants, they are primarily focused on supporting hospital discharge, and it's important to note that, and the workforce rather than the long-term sustainability of the wider sector. In section 2, that really references the external factors relevant to this process. I will draw your attention to sections 2.3, 2.5 and 2.8. 2.3 talks to the increases in the national living wage and the real living wage announcements in the autumn of 2023, and those did create significant pressures for our providers. Both the national living wage and the real living wage have been increasing at a significant rate over the previous year. And this can be seen in the table below, and 2.4 provides that table for your information. 2.5 talks to the fact that Bolton adult care services rates are set at a level which should enable providers to pay the real living wage. Due to other market pressures, this will not be able to be contractually enforced in this financial year. However, we are working alongside our providers and we're managing that via the contract variation route. And finally, for this section in 2.8, several representations from providers regarding fee uplifts were received by a number of providers, and those broke down their pressures. We also, as you'll remember, undertook a significant piece of work in the fair cost of care calculations work, which provided us with information relating to pressures in the system. In section 3, this references market sustainability and market shaping. And again, I'll draw your attention to sections 3.2, 3.3 and 3.4. Section 3.2 describes the adult older care population and the fact that currently we are at 95% occupancy, which means we have nearly utilised all of the available home placements that we would have. We are also significantly pressured in relation to dementia residential and dementia nursing beds, and that occupancy rate sits at 97%. That's important for context to understand that it makes it very difficult to negotiate further, and it is causing pressures in relation to top-ups as well, something that is under review and under development. Section 3.3 talks to our home care market, and we do in Bolton have a very vibrant and a good supply of home care, but it's one that we continue to actively support. And then finally 3.4 talks to our 23 supported living units in Bolton, and the fact that currently we are working with a variety of developments to make sure that we can continue to offer supported living in Bolton. I will move us on to 3.6, where it talks about the whole system approach and that we need to make sure that we've got stability across the whole market. And then the remainder of this section talks to the other things that we do to support our provider market, including we have regular consultation and engagement sessions. We offer me learning to our providers, which means that there's subsidised training for their staff to undertake. And we obviously have our robust quality assurance and improvement offer, which is enhanced in Bolton in the sense of the one-to-one support they do get from the team when they need it. And then fee setting work in 3.12, it talks to how we've undertaken the work and the number of steps that we've taken in to do this. And it'll detail various data collection returns and the number of workshops that we've had with cohorts of providers. And the important bit, section 4 talks to the fee uplifts for approval. You'll see the table set out and it includes the proposed fees for 24-25. And I've also asked that it includes the total fee over the last 2 years that we have offered to providers to give you a context over the last 2 years. And then finally, from a finance perspective, the total cost of the fee uplifts to be approved is 10.69 million. To fund this pressure, to fund this fees pressure, it's proposed to use a combination of the resources, including the adult social care precept, inflationary uplifts to the budget, and the adult social care grants. The legal implications are set out throughout the paper, and we have undertaken a full EIA assessment as part of this process. So finally, Chair, the recommendation is to approve the rates as detailed in section 4 of this report in relation to adult social care. Happy to take any questions.
Thank you. Thanks very much, Tracy. It's as somebody, this isn't my usual area, but I did find the report very easy to work through. It laid it all down, etc. The only bit where I'm just going to query is the actual percentages in the increase in the fees that were finally agreed on. Can you just take me through a little bit more on the rationale on that?
Yes, certainly, Chair. So the rationale is based on it's based on a number of factors. One being the information that we get from our providers in terms of their costs. The other important factor is that we also work as part of, and Lynn may come in on this, as part of a GM finance leads cohort together to make sure that our fees are roughly aligned with our other neighbouring areas. So there is a piece of Northwest work which happens running alongside this annual process. We use the data and information provided from our providers, and we also use the financial information that we have access to in our systems. So it is a correlation of different data sets that enable us to then agree with Rachel's support as the DAS actually what is a fair rate of fee increase for providers, but stays within a budget envelope that we can manage.
Yeah.
Rachel,
Okay.
I don't know if you want to add anything.
Nothing specific. I don't know whether, Lynn, you'd have anything in terms of the science behind kind of the different percentages, really, as to how we get to them.
Yeah, I think probably the most important thing on it is, so home care has a very different percentage to care homes, because home care is more salaries rather than any other, and just your travel costs, whereas care homes have all the accommodation, gas, electric. So we do base it on the inflation rates that are recommended, and then the real living wage. We put that into our numbers,
Yes.
and then look at the amount of money that's available just to make sure it's affordable. But with all the grants that we've got this year, we managed to do that, the ask that people have come forward with.
Grants and the 2%
Yeah.
council tax uplift.
Yeah.
So we've got Councillor Bamford.
I'm fourth.
Hi. Hello. Yeah. Yeah, I know. Yeah.
I said
Come at
Bam-
me if I say his name wrong.
Excuse me, I said Bamforth.
Oh, it's fourth. The fourth bridge. I always get told that.
Yeah, fourth. Yeah, as I keep telling everyone, Bamforth is posh, Bamford isn't. But anyway, just correct me if I'm wrong. If I remember rightly, my very first meeting on this was on the fourth quarter, and Rachel and members of her staff sat down with me and they talked through a lot of matters. If I'm not mistaken, there's a potential that funds sometimes get released towards the back end of the year. If I'm not mistaken, I'm sure they said sort of October, November. Has the should we say the increase for 24-25 taken into account for anything that may be coming through for, say, October, November, or are we just sitting back and waiting because you can't predict that because nothing's been announced yet? That's all. Thank you.
Thanks, Rachel.
Thank you. So some of the announcements that we've already had from National is that we've been given 2-year settlements around what would be winter funding that historically we used to get kind of quite late on, leading up to kind of Christmas, like the September, October, November, and then with quite strict criteria. So we have already been told for this financial year what that money is and what it should be spent on. So a proportion of that is built into here in terms of fees. As an example, we did get an additional announcement in this financial year that we're just concluding now, around kind of the October, November time. We chose not to put that towards fees because we had already dipped into our reserves to go to the percentages that you see in here that we uplifted this in this financial year. So what normally happens is any additional money that comes in would be very specific to put in additional schemes or additional capacity. So we wouldn't be seeking at this point to be predicting any more money in to uplift fees. I hope that makes sense.
Thanks, Rachel. Councillor Galloway.
Thank you, Chair. Can I ask about agency fees? Do they tend to be double? What is how much more expensive are they to employ?
So agency fees in relation to staffing in the council.
Yeah.
So they can vary. It depends on whether that's agency to cover social work post, a commissioning post, or kind of a technical post. That they are significantly more than our salaries. This report, however, doesn't cover our in-house services. This is purely what we are purchasing in terms of the market.
Yeah.
All right, how the market. Yeah, so it's up to the market how they.
So if I think Councillor Galloway might have been talking about agents who work within the market, but presumably if nursing homes are using agency, that doesn't alter our fees anyway, does it? No. That's an internal issue for them. Yeah.
And are they finding it tough? Are they finding it tough to employ?
I think some providers are finding it harder than others. I think it is still a significantly pressured market, particularly around nursing, and we continue to see that. And whilst it's not meant to be a point of assurance, all other areas in the Northwest are the same. So all our colleagues are finding the same pressures. So yes, some are finding it very difficult and challenging, and it's one of them. It's a little bit of a cycle, Councillor Galloway. Once you're in the cycle of kind of a lot of agency staff, it's very hard to break that cycle then. So that's why we are offering those additional elements of support. And when we've done the wider engagement events, it's why we haven't been solely focused on fees. Whilst they're absolutely critical, it's also around the wider support we can provide in terms of training, development, and that kind of quality assurance aspect, which hopefully helps retain staff once they do join an organisation.
Yeah, I think it's the same in children, so you've got to be a little bit more innovative.
Yes.
Thank you.
Definitely. Okay, thank you for the contributions there. Unless there's anything else, I think I am obliged to say approving that report.
Yeah, I was just going to say you've definitely approved those. Yeah, thank you.
Thank you, Susan.
Thank you.
And thank you everybody for your time, and enjoy the rest of the day.
Thank you.
Thank you.
Bye for now. Thank you.
Bye-bye.
Bye.